It kills silently, affects millions of Indians, and many don't even know that they are living with it. It has become one of the biggest health threats of modern India. Hello and welcome to NewsX. I'm Kashish Dhawan. Today, on the occasion of World Hypertension Day, we focus on a health condition often called the silent killer, hypertension. The theme of this year's WHO World Hypertension Day is controlling hypertension together. Check your BP regular. Defeat the silent killer. And to understand this growing health crisis, especially among younger Indians, we are joined by cardiac physician Dr. Mukesh Gupta, an expert in non-invasive cardiology with special focus on heart failure, hypertension, and hyperlipidemia. Dr. Gupta, thank you so much for joining us.
Thank you.
Doctor, let me begin with the most basic but important question. What exactly is hypertension and why is it being called a silent killer?
Yeah, basically hypertension means if the blood pressure is above than normal, and that too, we now count it at 120/80 in all age above 12. It should be your normal blood pressure is 120/80. If it goes beyond 120/80 till 130/85, we call it a borderline hypertensive. But if it is more than 130 and 85, then we label it as a hypertension. And it applies across the age. In the previous year, we used to tell the patients that if your age is such, is like 60, then this is your blood pressure. Now, across all the age, 120/80 is the borderline, it's the cutoff line. Yes, it is called silent killer because it doesn't cause any symptoms. Like whenever you have, like infection, you got fever, or sometimes you got cough due to the viruses. Your blood pressure increases and there is no symptoms at all. Occasionally, some patients may have experienced some headache or something, heaviness overhead, or some, breathless on walking. But many of the patients do not feel any symptoms till it is very high. And definitely, it damages your organ like heart, kidney, eyes, and brain primarily. Yeah. So it is called a silent killer.
Understood, sir. So, like you said, it does not have very visible symptoms. But as per studies nowadays, we are seeing Indians are witnessing a worrying rise in hypertension cases, especially in people among the age group of 20s and 30s. Yeah. Why? What do you think what kind of lifestyle changes are driving this trend? Because initially it was something that was experienced in people above the age of 50, right?
Yeah, definitely. In the previous years, we didn't actually think of hypertension in younger age people. So many a time, the normal doctor or the general practitioner, did not, incline to even check the blood pressure of the younger people. But nowadays, we are getting the hypertension in young population also, even the teens also. So age is no bar now. The blood pressure can be increased in any patients in any age, at any age. The causes in the younger population in India is first the lifestyle changes, stress. There is a lot of stress especially in metros, and even the semi-urban or rural population. There are stress now for some economic reason or some other reason. And other thing is the lifestyle. In the yesteryears, we used to exercise, we used to cycling, go to, use cycle to go to school or to market. But nowadays, everyone is catching up with on car or some bikes, and even the poor population do take buses and trams, so they don't walk at all.
Yeah.
So these are causes which causes hypertension in younger population in India especially, and in our region, in my practice.
Yes, sir. Definitely, it is one of the biggest reasons because the lifestyle over the time has changed. Our worlds have gone digital. Our things have become easier than before. Earlier, like you mentioned, people used to ride on bicycles, walk on foot to the schools and everywhere. But nowadays, it's a kind of a different situation. Sir, tell me something. How can the younger generation make those lifestyle adjustments at this point? Because, see, like I said, the world is evolving every single day.
Yeah, definitely. There are few tips I think I give it to my patients. First is and foremost is the weight loss if the patient is obese. Weight loss, because every 1 in 3 patients or every 3 population in our population, I think is I can label them obese by definition of nowadays. So first I suggest to go for weight loss. Second is the smoking cessation, that is must. Third is just brisk walk. I suggest my male patients that you must walk 4 kilometers in 40 minutes. And to females, I suggest 3 kilometers 30 minutes, 4 to 5 days a week. That is more than sufficient. That is cardiac exercise. You can level it a cardiac exercise. Another thing, they can change just a little modification, like less salt out. Total salt should be, I think, less than 4 or maybe preferably be less than 3 grams per day.
Yeah.
The consumption should be there. And avoid stress, avoid fatty meals, and do some pranayama or yoga, so that meditation, so that your mind becomes tension free.
Definitely.
These are tips when I always give to my patients for lifestyle changes.
Definitely, sir. This actually brings me to an important question that was going on in my mind regarding, is it like a thing which is like gender specific, that women are getting more affected and men are getting less affected, or is it affecting everyone in India on an equal proportion?
Definitely, yeah, this is a good question. In the previous years, we used to say that the female are vulnerable to the cardiac problems after menopause.
Yeah.
That was the saying. But nowadays things have changed due to the stress and lifestyle, plus the women are competing with the male equally and taking part in every aspects, every field of the year. So, but still there is a slight male preponderance over the female, but not as much as when you used to think in the previous years. So it is almost, you can say, equal. The exercise which I advise are differently because of the body weight, body mass index.
Yeah.
That was the case.
Also, sir, like you mentioned that, of course, the younger generation should focus on fitness, but aren't the cases nowadays coming, like hypertension or heart attack cases, cardiac arrest cases, coming from a generation that is going to gym on a regular basis, working out and everything? Sir, there is one big example of this TV star Siddharth Shukla. I hope you remember.
Mm-hmm.
So
he
used
yes,
to go to gym on a regular basis, and then he suffered from a cardiac arrest. And recently we saw a similar, like, it's not sure, still it is getting the police and everyone is still wondering what exactly happened in Pratik Yadav's case. He also used to go to gym on regular basis and still suffered from a similar situation where the cardiac arrest was there.
You see, first foremost, let me think that it is a disease. It it can catch, anyone can catch these diseases. So basically, whatever I enumerated just now, the risk factor or some other risk factor, they are only the risk factor for around 30% population. Rest 70% population may not have any of the symptoms, and they may be going to gym or having an active life. So the exact cause of in those population we don't.
But why are so many cases still going undiagnosed?
Because many a times here in India, if you get some chest discomfort, you will level it at my stomach, गैस हो गया, मेरे पेट में गैस है, heavy हो गया. So main thing is कि you have to understand the pain, the meaning of pain. The pain may be heaviness in type, something maybe some weight is there on your chest. It may be the heart burning in type. So there are many different types of pain. It's not just muscle pain which you are facing regularly in your life.
Yeah.
It is a different kind of altogether. You may have feel something over sternum, some uneasiness. You may feel uneasiness. That is all causing of the heart symptoms.
Okay, so how do those Indians, those adults, those Indian adults get screened on this?
Yes, definitely. There are several tests for it. First of all, if you feel any of the problem in the chest, like chest discomfort, heaviness, or especially on the walking or exertion, even a shortness of breath, especially those with diabetic person, those with who are smokers, those who are hypertensive, those who have lipid profile, high lipid levels, must go for an cardiac checkup. And first of all, ECG is the basic initial test. There are several tests like treadmill test we often do as a screening procedure for the cardiac element.
Okay, sir.
And that is available.
Yeah.
That is available across the small cities, large hospitals, small hospitals, even small kasbas may have a treadmill test. But the consultation with the doctor is very important, who will diagnose the disease.
Okay, sir. I also want to understand it by age group. How often a particular age group should visit or should get themselves checked, their heart checked. Talking about starting with the age group of 20 to 30 and then 30 to 40 and 40 plus.
Yeah. You see, basically 20 to 30, I would not advise, any person to go for any test, cardiac test or something. But definitely one must go for a simple blood pressure test and diabetes sugar test. These two tests should be done in 20s to 30s. In 30 to 40s, I would suggest to go for additional lipid profile one. And so is the case with the 40 to 50. But basically, a screening test can be done. Usually you suggest after 30 or maybe 35, a treadmill test, which is being done in most of the center as a screening procedure, like in preventive health checkup, preventive heart checkup. Almost all includes a treadmill test. And that is a very basic test that is easily available. Everywhere can teach cheap also. So, one must go above 35.
Okay, so what should be the frequency?
Once in a year is more than enough.
Okay, once in a year is more than enough. And sir, in today's world, everybody is under constant stress. There are wars going on, there is economic uncertainty, job pressure, social media anxiety. Of course, the anxiety coming in from social media is the biggest threat to the teenagers, to the generation, to Gen Z, the millennials and everyone. Now, can chronic mental stress directly impact blood pressure and heart health? Is the biggest question for the youths today.
Yes, that definitely increases the blood pressure. That definitely increases the blood pressure because the lifestyle has got basically related to many diseases, not only the hypertension. It affects your coronary artery, like it can cause heart attack also. It affects your brain also. It affects your sugar level also. So these are the stress which are in newer Gen Z, you can say Gen Z.
Yeah.
So the first thing is the weight reduction in those basically usually they are obese. They go for usually a fatty meal all the day. Both the times I think they go for the outside meal and which contains a lot of fats and cheese, etc. And salt is also too much in those systems. So it increases the blood pressure. It also causes the cholesterol deposition in your coronary artery, and that in turn causes, because one of my youngest patient is 18 years old who has got the heart attack. So and I have many patients in 20s, 30s who have got heart attack. But yes, that is the case now. We can't avoid it. But two things or three things they can do, that the food they eat, they must take care of that. Eat more citrus fruit, green leafy fruit. Green leafy vegetables and citrus fruit should be a major component of your diet all the time in every meal. And avoid less and less strain. Take less and less strain. Go for a meditation and regular exercise. These are the tips which I have that will work in these scenario also, for Gen Z also. Those tips which I have referred in the evening in the earlier conversation matters a lot for those cases also.
So what is the advice, like if you have had patients who suffered from anxiety or stress or like any social pressure or like job uncertainty kind of pressure, what was the advice that you gave to them to take care of their heart health?
Yes, avoid strains, go for a meditation and take regular exercise. These main three things I will emphasize about. And always I tell my patients that you must go for a regular walk or do swimming or cycling, plus avoid strains as much as you can. For that, you can go for a meditation. A regular meditation does a mental relaxation a lot, and that helps in turn in hypertension or in any cardiac diseases or any disease for that matter.
Also, sir, nowadays after COVID, people have started panicking quickly whenever actually panic quickly whenever they hear about a new disease. And now Hanta virus is appearing in headlines. So how fear and health anxiety itself increase cardiac risk or blood pressure problems, sir? Because every day we see news related to Hanta virus or new some new virus coming in news in the headlines, and people, of course, they start panicking, they start worrying. How is it increasing? Like, how is it affecting their blood pressure problem?
No. First, let me tell you that we do not have to fear about hantavirus. Hantavirus is there since long. It's not a human disease. It's basically it's found in rodents, mice, rats, and that kind of small animals. So it is there since many years, many decades, you can say many years in America and in Europe, especially in the central and upper Europe, and in the Oriental country like Korea and China.
Yeah.
And basically, it happens when the human comes into contact with the rodents' saliva, beat or urine. It is not transmitted, like COVID transmitted through respiratory, problem. It comes when when the person is comes in the contact with the rodents, feces or yeah. So, and definitely it has got nothing to do with. I don't think that India has any hantavirus disease, established hantavirus disease in our country. But definitely, America has got it since long. I think few hundred to few thousand cases are detected in America and Europe and Asia also, Oriental part, the upper part, which China and Korea. And definitely, we don't have to worry at all. Yes,
but sir, somehow, since that news of 2 Indians getting affected with hantavirus is creating a panic in people, how is it affecting their heart health?
Yeah. There are two types of diseases. One is very common in America subcontinent, and that affects lungs and heart.
Okay.
Another is just a hemorrhagic fever, like you will have spots on your skin and fever, with sometimes renal symptoms, renal failure. But the American virus which is there is more dangerous than which affects the virus those affects the Asian one or even the European one.
Yeah.
Because we have got chances of recovery much more than them. There is a very few fatality rate, while in the American subcontinent, the mortality rate with the lungs infection is very high, 20 to 40% average. It may have go to the 50%, even every 1%, and there is no treatment at all. There is no treatment at all. Diagnosis is very difficult, so you have to be unsupportive. Like in the COVID, just we were giving the support.
Yeah.
So just life support is required. That is all. And that much we can do. Nothing else we can do. There's no antiviral, drug available till date.
But sir, yeah, of course, like you said, there is no cure as of now for this. But it, like, circling back to my question over here.
Cannot be. It cannot be transmitted human to human.
Okay.
Yes.
But somehow, sir, it is leading to fear and health anxiety, triggering cardiac risks and blood pressure in people.
No, it's a different game altogether. It's nothing to do with the cardiac diseases like coronary artery disease or blockage in the coronary artery or hypertension or health. That cardiopulmonary syndrome is a different disease at all, which affects in the American population. We don't have to fear at all for any cardiac.
Like I said, sir, it is about fear, right? With us Indians, the biggest problem that causes our BP to shoot like up and down is fear. And over the time, it has been going on with us. So we see fuel prices hiking. We are scared. We see war situation happening. Strait of Hormuz getting blocked. Our heart starts to panic. Our heartbeat starts going up. So how is it increasing those kind of situations for Indians?
Yes, definitely. You said it earlier also. Gen Z is being affected like these kind of things. Some war is going there, your adrenaline increases, your blood pressure will increase. You have got tension when the fuel prices rises. So it affects, it causes increase in the blood pressure. And you can tell them, you can tell it that it is hypertension. It can cause hypertension. It is basically due to the stress. Anything, stress will lead to the increased blood pressure, means hypertension.
So, do you think social media detox is also one of good ways to actually go away from this problem?
But you have to live with the social media. There is no way out. You have to adjust your life with these gadgets, with these social media. We can't just be like a saint and go to Haridwar, and you have to live with it. There's no way out.
True that, true.
You have to learn. Every person, Genji, have to learn to counter these problems.
Definitely, sir. So, doctor, on this World Hypertension Day, my last question is, what is the one message you want every Indian family to remember about protecting their heart health?
Walk, walk, and walk.
Definitely. So, viewers, that is the message from Dr. Mukesh Gupta. Walk, walk, and walk. Hypertension may be silent, but understand its consequences are deadly. Experts have warned that the stress, unhealthy lifestyles, poor sleep, processed food, and lack of regular health checkups are pushing more Indians, especially the youth, towards serious health risks. The message is clear on World Hypertension Day. Know your numbers, check your BP regularly, and most importantly, please don't ignore the warning signs that your body may not even show. Dr. Gupta, thank you so much for joining us and sharing your important insights with our viewers. Until then, viewers, stay safe, stay healthy, and thank you for watching.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.